We are now joined by Jim Tedesco, who is the Bergen County Executive. Good to see you, Mr. Executive. How you doing?
I'm good, Steve. How are you? It's been a little over 8 years since we got together.
And let me ask you this: does Bergen County still have 70 municipalities?
Still does. So almost 1 million people. The largest county in the state, larger than 5 states in the nation.
And larger than 5 states.
Yes, sir.
The most pressing issues in Bergen County, other than traffic on 17, is what? Okay, yeah, you knew I was going there, Jeff. Okay, biggest issues. Go ahead.
Trying to take care of the people. The county is in good shape. From a standpoint, Steve, of things happening in Bergen County, we're doing really well. And could we always improve? Sure, but at the end of the day, taking care of the people that need help the most, that's really what we're focusing on. So whether it's mental health, whether it's addiction, whether it's more open space, whether it's trying to help food insecurity, the things that really are affecting the people today, right? I can't deal with a lot of the kitchen table issues because we don't control a lot of that. Our part of the budget's the smallest part of the taxpayers' taxes. But at the end of the day, because we touch so many people, we believe that we have a responsibility to help people have a better life and to make their lives as best they can.
So let me ask you this, Jim, the county option hospital-free program, what is that and who does it impact?
So the county hospital option plan was designed to help folks that are on Medicaid get services from all of the hospitals here in Bergen County and throughout the state of New Jersey. The program is now statewide. It started as a pilot and then went statewide. So it's really to make sure that those folks that need that type of health care, that really are in that section where they don't have a lot of commercial insurance, or they're not charity care, but that are on Medicaid, that they have places that they can go and get service. And so this program recognizes and pays the hospitals for helping people with Medicaid provide all of those services. So those that provide a lot of services stand to make more money than those hospitals that don't.
Where's the money come from, Jim?
So it comes from CMS, from the federal government to the state of New Jersey, and then the state of New Jersey administers it through the county option program statewide.
If someone goes on your website, can they access this?
They can find out about the county option,
Okay.
but it's not a program. It's not a program that touches the individual. It's a hospital-based program. So they submit numbers to us every quarter to say we treated this many Medicaid people and they're entitled to this much reimbursement. You got it. So they pay us in the beginning. They pay us a fee based on their prior use, their prior service, and then when they true up, we send them back money based on how much activity they have done with Medicaid residents.
Let me ask you this. I was joking. I'm not joking. There are 70 towns, and some
Yes,
of them
sir.
are really small. So here's the thing I keep wondering about. The issue of home rule gets talked about all the time. Home rule. We want our own schools. We want our own police department. We want our own fire department. By the way, keep our property taxes down. It doesn't add up. What specific, tangible, impactful initiatives are there in Bergen County for, if not merging of towns, because that's not going to happen, shared services? County Executive Tedesco, please.
So just a month ago, I announced that the county will now provide free 911 service for all 70 municipalities. So today, many towns answer 911 calls with their own people, police officers or individuals. And then some are regionalized. We have a large 911 communications center. And when we started to look at it, we realized that we could take on all 911 service for the entire county, make it a regionalized 911 center, and the cost would be borne throughout the county for that service. So we just announced that, and we've had probably 6 or 7 towns already come on board. So that'll be a direct savings. Now, listen, at the end of the day, the taxpayer is going to pay for it either in their local municipal tax or at the county. But what we can do is leverage our buying power and our infrastructure where the local municipalities can't do that. So there's a perfect example of a shared service and the benefits that that would provide. We just stood up a little over a year ago, EMS transportation in Bergen County and throughout the country, New Jersey. There's been a shortage of EMS volunteers, right? The volunteer fire departments, volunteer EMS. Well, the mayors came to us and said, you have to help us. We don't have the volunteers anymore. We can't put an ambulance on the road. Our taxpayers, our people are waiting for 40 minutes for an ambulance. So within 6 months, we stood up an ambulance response countywide. We now have 6 ambulances on the road. We've transported over 8,000 people in about 15 months to local hospitals. And here's a perfect example of what the county's role can do to improve the welfare of the people of the county.
Got 30 seconds left. Traffic going to improve anytime soon, up around 17, the bottom? Go ahead.
Great news. We got approval for eliminating the bottleneck on Route 17. The state and the NJTPA have funded the project. We're in engineering, and I won't tell you the completion date because it's out there, but $386 million is now earmarked for the road widening of the bottleneck, and we're on our way. It was one of the things that I said when I got elected 10 years ago I wanted to do, and we're finally there.
We will hold the county executive of Bergen County to that. We'll have him back. Even though he didn't give us a date, he said progress is being made. Jim Tedesco. Hey, Jim, I want to thank you so much for joining us. We appreciate it.
Steve, thank you so much.
I'm Steve Adubato. That's the county executive. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating 30 years in public broadcasting. Funding has been provided by Holy Name, the Turrell Fund, a foundation serving children, the New Jersey Education Association, Kane University, Johnson & Johnson, New Jersey Children's Foundation, New Jersey Sharing Network, the Port Authority of New York and New Jersey, and by the Fidelco Group. Promotional support provided by the New Jersey Business and Industry Association, and by NorthJersey.com and Local IQ.
Hi, I'm Abby. You might see me as an ordinary person, but I've been living with a brain injury since 2018. Opportunity Project gave me hope, and I've gained confidence through job skill training and helping my family. Despite my challenges with memory, I see a possibility to keep improving.
If you have a brain injury, you don't have to face your road to recovery alone. Learn more about Opportunity Project and its partnership with Children's Specialized Hospital.